as well as recognise the many millions of grandparents who play a critical role in their families and the community. Their courage, their resilience, their life experiences, come to play in these natural and man-made disasters of our world. When I was prepping for this town hall, I thought to myself, where do I fit in? I'm not a grandmother, not likely to be a grandmother. And then I thought of Gladys. Gladys was my nana. But I also started sort of thinking about, who is a grandmother? Who do grandmothers symbolise? How can we all take solace from these important roles? And I started reading Anne Frank's story. And Anne Frank's maternal grandmother died of an illness shortly before she went into hiding. And her memory throughout her diary both haunted her and comforted her. As her confinement dragged on, Anne had dreams of her grandmother that filled her with hope and with strength. So she began to view her grandmother as almost a guardian angel. Now, not all grandmothers are guardian angels, and grandmothers are not a homogeneous group, just like grandfathers. But then it took me to a place of, perhaps we need to, in the midst of this pandemic, start to think about the symbols of hope in the times of great suffering and sadness that we're going to be feeling today, but also into the future. And that is my opening to introduce a great friend and colleague, Peggy Edwards. Peggy is a writer and very popular speaker on aging and grandparenting. But most important, she's one of those people that you almost cannot deny joining. She's an activist for the rights of older people. She's a former policy analyst with Health Canada and the World Health Organization, co-author of International Grandparenting, A Boomer's Guide, and she writes a monthly column on grandparenting for the 55 Plus magazine. She co-founded Grandmothers Advocacy Network, which advocates at a local, national and international level for the rights of grandmothers, older women and vulnerable young people in sub-Saharan Africa. And the One World Grannies, one of the some 300 grandmother groups who work with Stephen Lewis Foundation in solidarity with grandmothers in Africa who are raising millions of children and young people orphaned by AIDS. Peggy, it's a great pleasure to have you with us today as a friend and colleague, and as one of those people that you just cannot bear not to be in a March week. So over to you, Peggy.
Thank you. Thank you all for being here, and thank you, Andra and Jane, for your leadership and for setting this up. I'm really looking forward to it. I think we're going to have a good time together. You do have a resource list that Andra has put up on the chat box. You'll notice that there's a dearth of scholarly articles. And the reason is that because while the journals on aging are overflowing with articles on older people and the pandemic, there's very little on the specifics of grandparenting. So that you're from all over the world, and if you have other scholarly articles or particular articles that would be of interest to the people on the call and those who listen to the recording, please add those. The other thing I'd like to do in terms of that resource list is to acknowledge someone who's on the call, Mary Jane Stern. Mary Jane is my friend, and she's the co-author of the book Intentional Grandparenting, which is on the list. And she also co-authors the media column that we do in a popular magazine. So, Mary Jane, kudos, thanks for being here. There are many articles, videos, opinion pieces in the popular media on grandparenting in the pandemic. I didn't try to capture all of those. you can find them, the ones that are relevant to your situation, online. I do hope that this gathering is a significant way for us to learn more about grandparenting in a pandemic from personal and global perspectives. So I'm looking forward to hearing your stories, either today or by email later if you'd like to send me some of your stories. In my opening remarks, I'd like to focus on three things. First, some of the challenges and anguish that the pandemic has brought to grandparents, grandchildren, and their families. Second, the inequities and human rights abuses that are exacerbated by the pandemic, particularly among vulnerable groups of grandparents. And thirdly, the pursuit of opportunities to build resilience, human connections, social justice, health, and intergenerational solidarity. So let's begin by talking about the challenges. Number one, for grandchildren or for grandparents who do not live with their grandchildren, social distancing and not being able to hug your grandchild is heartbreaking. It exacerbates feelings of loneliness, grief, and uselessness, and situations of isolation and lack of physical touch, which we knew were real threats to the health of older people even before COVID-19. One of the most common questions asked of legislators when countries start to come out of lockdown is, when will I be able to hug my grandchild? And the answers are often confusing. On April 29th, the BBC reported that the Swiss authorities say it is now safe for children under the age of 10 to hug their grandparents, in a revision to official advice on coronavirus. However, the Health Ministry's infectious disease specialist said such meetings should be brief and not involve babysitting. So some confusing messages there as countries start to come out of COVID-19. Secondly, for grandparents who live with their grandchildren in multi-generational living arrangements, which is very common in many parts of the world, the evidence is underdeveloped and mixed. Typically, older people in such households have similar odds of being sick as those who do not live with grandchildren. In India, multi-generational households may offer certain morbidity mitigating factors, such as greater kin availability, closer network ties, and the companionship of grandchildren, which is known to improve overall well-being. Research from other Asian contexts show that grandchild care, living with grandchildren, is neither universally beneficial nor detrimental to grandparents' self-reported health. And as yet, we know virtually nothing about the effects of multi-generational living arrangements on the number of cases and deaths of older people during COVID-19. In the world, grandparents play important roles as teachers, mentors, nurturers, historians, spiritual guides, cheerleaders, and holders of family narrative and social memories. In most countries, grandparents play an essential caregiving role that allows parents to work and earn a living for the family. COVID-19 has meant that many grandparents are unable to be the primary or part-time caregiver for their grandchildren, just when daycares and schools are closing. This creates an enormous problem for parents, especially those who are essential workers or in the informal economy, and for parents who have to work from home, provide homeschooling, and look after a household without help from grandparents, all at the same time. The devastating economic recession caused by COVID-19 has reduced grandparent savings. This has a chilling effect on their role as financial supporters to their grandchildren's education and activities, and to the financial stability of the young families that they love. Fourth, another challenge is understanding and addressing the effect on grandchildren and their relationships with their grandparents. Professionals in education and mental health are just beginning to explore the effects of COVID-19 on children and youth. I suspect that grandparents will be among the first to observe these effects. both on the behaviors and mental health of children, and on changes, to at least some extent, in the trusting relationship that they've established. I think it's important for grandparents to explain why they cannot hug their grandchildren and assure their adult children and grandchildren that they are doing everything possible to keep themselves healthy. I have found this reassurance is especially relevant to older grandchildren, to teenage grandchildren, who are aware that their grandparents are particularly vulnerable to the virus. The final challenge is addressing the inequities and human rights abuses that are exacerbated by the pandemic, particularly among vulnerable groups of grandparents. The COVID-19 pandemic has clearly demonstrated the very real and lethal impact of ageism on the fundamental human rights of older people. This is evidenced by the appalling mistreatment of older people in long-term care, systematic severe restrictions to health care, resulting in what has been described in the media as the culling of older persons, and the treatment of older people in the press and on social media, such as the trending hashtags describing COVID-19 as boomer remover and granny killer. So let's just take a minute to look at these particularly vulnerable groups. I hate the word vulnerability, but I don't know how else to describe it. While there are some distinct definable factors that increase vulnerability, usually the problem is that these factors intersect. Poverty, gender, race, ancestral origin, and low levels of education often build on each other and multiply in their effect. COVID-19 has shown us once again that the communities, including older people, who are worst hit are those who live in low income and racialized neighborhoods and regions. Among older people, women, especially those who live alone, are far more likely to live in poverty and near poverty than men the same age. Grandparents in Indigenous communities may be at risk because they tend to suffer multiple chronic diseases at earlier ages and because their access to health services is limited. At the same time, what we've seen in Canada is that during COVID-19, Indigenous communities made it clear right from the start that protecting their elders, their knowledge keepers, was a priority. They strictly executed their pandemic preparation plans with impressive results. Another vulnerable group that we all know about, grandparents in residences and long-term care. Highly vulnerable to contacting COVID-19 and facing serious health consequences. In Canada, to our shame and outrage, 82% of COVID-19 deaths have been in long-term care residences. The other highly vulnerable group is grandparent-headed, sometimes called skip generation households, where there's no middle generation in the home and the grandparent, most often a grandmother, takes on the parenting and head of the household role. This occurs most often in sub-Saharan Africa, where countless grandmothers are raising some 15 million children orphaned by AIDS. They've become a continent's caregivers by default, inheriting a generation of boys and girls who need to be fed, clothed, schooled, and loved through the trauma of losing their parents in the HIV and AIDS pandemic. Yet in the face of the intersection of grief, poverty, and discrimination based on age, gender, and association with HIV, the grandmothers are turning things around. With the support of each other and their community organizations, and some small resources from outside, many are able to care for anywhere from 2 to 12 children, to work in the community, to learn literacy and job skills, and start to demand their rights. But now there's a huge problem. The grandmothers in Africa face the intersection of 2 pandemics. We have reports that the pandemic and reactions such as lockdowns and isolation are hindering the delivery of life-saving medication for HIV. That moving precious and limited health services resources to deal with the pandemic means limited or no access to other essential health services, including vaccines for children and treatment for chronic disease. That grandmothers who rely on selling their products at the market have lost their incomes. That having no money for food means the threat of malnutrition and starvation is back. That violence related to police enforcement and domestic abuse has risen. That the grandmothers fear their girls will not get to return to school, and that practices such as child marriage will increase. The African grandmothers and grandparents all over the world who are raising children on their own fear they will die, and their children will be re-traumatized and left with no one to care for them. Many of you are familiar with two organizations that are working to address this situation, and I encourage you to learn more about these organizations and consider joining us. You don't have to be a grandmother. Others are welcome. So the first one is the Grandmothers Advocacy Network, and there's a number of people on the line that belong to GRAN. It's a national network of volunteers working across Canada to advocate at local, national, and international levels for the human rights of grandmothers, children, and youth in sub-Saharan Africa. As we go forward, GRAN will be offering opportunities to learn, connect, and take action on how COVID-19 is impacting our advocacy areas of focus and the lives of grandmothers in sub-Saharan Africa. We are committed to making a meaningful contribution to ensure that the global response and its aftermath will be guided by peace, justice, and equality. The second organization I'd like to highlight is the Grandmothers to Grandmothers campaign. And again, there are some people on the line who are involved in that. The Stephen Lewis Foundation Grandmothers to Grandmothers campaign is a dynamic movement of thousands of grandmothers and grandothers. There are some 250, perhaps 300 groups across Canada, and groups have now formed in Australia, the UK, and the United States. The grandmother groups are committed to three goals: raising awareness, building solidarity, and mobilizing funds for community-based organizations that support African grandmothers and the children in their care. Currently, the campaign is very involved with African grandmothers and grandmother groups in Canada and other countries to implement programs to address the COVID-19 virus and to protect both grandmothers and the young people in their care. So lastly, I just want to turn to some opportunities. Alex Kalashi on one of the previous calls pointed out that the Chinese word for challenge is the same one as for opportunity. So what are the opportunities coming out of this pandemic? Number one, perhaps one of the most positive things that's come out is the enhanced use of digital communications, such as Zoom, FaceTime, and mobile phone apps that enable grandparents and grandchildren to connect. Now is the time to close the digital divide between the old and the young, and to enhance opportunities for digital literacy among grandparents and older adults. Secondly, COVID-19 begs us to go below the surface of public health and medical strategies to confront the underlying inequalities that drive disease, to enact policies, legislation, and programs that provide a basic income and reduce inequities, the gap between the rich and the poor, and the isms that foster hate and inequality, racism, sexism, and ageism. COVID-19 has opened the door to renewed efforts to support the rights of grandparents and older persons to health, meaningful family relationships, lifelong learning, financial and social security, political participation, social support, and freedom from violence. It has shined a light on the global need to adapt a convention on the rights of older people. Is Mark Gillis on the line?
Yes, I am.
Hi, Mark. Okay. Could you just take a few minutes to tell us a bit more about the Convention on the Rights of Older People?
Sure. Well, International Longevity Centre Canada, where I'm the president, has been working on this for some years now, as have IFA. Jane is a leader and continues to be a leader in that area, along with others on the phone call. The basic idea is that, like other groups, women, persons with disabilities, who have enjoyed the benefits of having a convention, we've been arguing that older people need a UN convention as well. I think that COVID-19 has really shone a light on why this is so necessary now, in terms of what we've seen, for instance, in Canada in long-term care. We're in a country that has incredible legislative protections against ageism, and yet, as Peggy mentioned at the beginning of this forum, that 82% of the deaths in Canada have happened in long-term care. And so we know that that is not enough of a protection. And we have been using the opportunity that the horrible pandemic has given us to really put pressure on the Canadian government and to put pressure internationally to move forward on the convention. One of the great things the convention would give us, just to give you an example, is we would have the opportunity to go before the United Nations Human Rights Council every 4 years and track the changes that the Canadian government is making in regard to the rights of older persons. I think in regard to long-term care, given the decades of lack of change despite pressure, there's an example of where we would want to be tracking Canada's changes on that. So that's one of the great opportunities. There are many others that conventions give. One of the really great pieces is it empowers the rights recipients. And I think right now, any empowerment to older persons would be greatly appreciated internationally. And all of the issues that Peggy's raised in terms of the challenges could be enhanced by the work of the convention. So there's lots of information on our website. We've got a write-in campaign to the Canadian government right now on the ILC Canada website. You can click on and send a letter into the Ministers for Senior and Minister for Foreign Affairs. We hope you'll join us. I think it's a really important time to push for change, as Peggy has illustrated. So thank you for the opportunity.
Thank you, Marg. Wonderful. We've learned about the importance of implementing regional strategies for fighting COVID-19 that are culturally appropriate and doable. It's not feasible to apply the Western rich country model of prevention and care in most of Africa, South America, the Caribbean, and other developing regions. Now is the time for rich countries to support low and middle income countries through increased funding for international development, and in the face of COVID-19, specifically in regards to equipment, medicines, vaccines, food, and economic recovery. This will take advocacy at all levels, support for international agencies championing the rights of older people, and strategic voting to remove racist right-wing leaders in places of power. Now is the opportunity to change the decline on the decline narrative on aging and grandparents as passive care recipients lumped into one big pot with no choices in their participation, rather than the diverse and dynamic contributors to families and society that grandparents really are. COVID-19 has shown the need to recognize, value, and provide adequate financial and practical support for the caregiving provided by grandparents and the unpaid caregiving mostly provided by older women for spouses, parents, other family members, and friends. COVID-19 has shown us opportunities to strengthen intergenerational solidarity, particularly around issues like climate change and the environment, which are top of mind for both grandparents and young people. I think that it's really important for us to listen to and learn from the grandmothers in sub-Saharan Africa who have so courageously handled the HIV and AIDS pandemic. Is Sarah Dopp on the line? Sarah?
I am, yes.
There you are, hi.
I had to unmute myself.
Would you like to say a few words about what we've learned about effective strategies from the African grandmothers?
And then we'll go to questions, Peggy.
Sure. Thank you, Peggy, and Jane as well. I'll just take a moment just to kind of add to what Peggy said this morning about the responses in sub-Saharan Africa, specifically with response to COVID-19 and supports for grandmothers and children in their care. The Stephen Lewis Foundation raises funds and works to support through partnerships with community-based organizations in 15 sub-Saharan African countries. The funds that are raised go directly to community-based organizations that are led by grandmothers or in support of grandmothers. And in the context of responses to COVID-19, community-based organizations are bringing a wealth of experience and expertise in responding to the AIDS pandemic, and they're demonstrating their abilities to adapt to the way they provide services and supports to grandmothers in the context of now 2 pandemics. And I just wanted to say a couple of things just to add to the conversation, that in sub-Saharan Africa, across the continent, there are vulnerabilities with regards to the healthcare system. And so the responses of community-based organizations have been critical to ensure awareness and talking about prevention and education around COVID-19. Community-based organizations have been adapting their programs and reworking the way they provide services to grandmothers and others in the community, providing water and soap, supplies to be making soap so that there's access to soap in households. And they've also been working to ensure that grandmothers who often are raising children and working in communities or selling at markets, having to go to market on a daily basis, have access to food. We've seen and heard from community-based organizations that there are limitations and restrictions on movement and curfews and having access to transportation. And so these issues create a different lens through which community-based organizations are ensuring that grandmothers have the access to psychosocial support, food for their grandchildren, food for themselves, and access to medication, not just antiretroviral medication for those living with HIV, but also access to medication for hypertension, diabetes, and the whole range of healthcare services that community-based organizations provide to grandmothers. I think I can leave it there and just open it up for conversation. Thank you.
Thanks very much,
Sarah.
Sarah.
Thank you, Sarah. I have one more comment, one more opportunity, and then we'll pass it back to you, Jane. And that lastly is the opportunity to embrace hope and love. Children bask and grow in the sunshine of their grandparents' love. In the words of Maya Angelou, that love recognizes no barriers. It jumps hurdles, leaps fences, penetrates walls to arrive at its destination full of hope. So out of a terrible pandemic, there are some opportunities. And I'll hand it over to you, Jane, now to moderate the Q&As. I would, however, like to have 5 minutes at the end to share a personal letter with you.
Certainly, we can make that happen. So now is your chance to ask questions of Peggy. I'd like to turn to Frances Zanadin and then to Jane Simmons. So Frances, could you kick the questions off, please?
Yes, good morning, good afternoon, good evening, everyone. Peggy, thank you so much for that wonderful presentation. And to Margaret and Sarah for adding to it. I actually had submitted some questions before the webinar, but I see that you've answered most of my questions already, primarily in the context of the human rights of older persons. And just picking up on what Margaret has said about the United Nations efforts led primarily by the Latin American countries to elaborate a convention on the rights of older persons. There has been a lot of resistance, mainly by developed countries, to having yet another convention. You know, older persons are covered by all the other conventions, and we've been having some difficulties. And Peggy, I just wanted to ask specifically that given the heart-wrenching statistics in Canada on the deaths as a result of COVID-19, is there any way that civil society in Canada can push Canada to support a convention? Canada, if Canada supports it, we'll be halfway home, I can tell you, because at the United Nations, Canada has a very strong voice. And if Canada can lead the charge, we will be on the way to getting a convention. So I'm just wondering whether your advocacy includes promoting and working towards a convention to protect the rights of older persons. Thank you.
So
Thank you.
we'll take Jane's question, and then we'll take it back to you, and perhaps, you know, Margaret, if you've got any comments also. So Jane Simmons, are you with us? Jane? Okay, so Peggy, if you can respond to Francis, and then we can go forward.
Sure. As Margaret says, there's an active coalition in Canada led by Margaret's group, the International Longevity Center for Canada. And we, you know, are doing all the things at this point. We're looking to Margaret to lead us to the next step. But definitely we'll be working on advocacy, and there's a number of groups involved. Gran, for example, is supporting it as part of that alliance. We also are a member of the GARA, the Global Alliance for the Rights of Older People, and supportive of their efforts in support of a convention. So those would be international efforts. It was interesting to hear you say that you think if Canada takes the lead, other developed countries will come on board. We do know that, for example, that Canada had the lead on the rights of children and really pushed that, and it did help sway other countries. So that's one of our messages to our government, and let's hope it works.
Margaret, would you like to say something?
Sure. We've been very, very active in pushing the Canadian government since the beginning of the pandemic. We put a little bit of extra effort with the support of IFA, the grandmother movement, in terms of supporting our writing campaign. I was before the Canadian Parliamentary Committee on COVID-19, and I spent the 10 minutes I had to lobby them on the convention. I met with the Minister of Seniors office. So it's under consideration, but it's a mystery to me why Canada hasn't stepped up. We've got a progressive government. It's very surprising. We're wondering whether it's maybe connected to Canada requesting a seat on the Security Council, and they don't want to anger the other developed countries who are opposing the convention. So that's the only thing we can think of. So once that decision is made on Security Council, we're hoping there may be a different response, but again, we're all guessing. But we continue to put the pressure on with the support of just about every major group in the country, all of the health organizations from CMA on, and all of the aging organizations have come on board. So there is pressure on the government, and I guess we will see what happens in the end.
So ILC Canada shares unconditionally what they do with everybody. So this is not a Canada fight, this is a global fight. And so those that want to have access to information through Barratt, and Alan Graham is on the line, it's the Global Alliance for the Rights of Older People, as well as Margaret, then please put your questions in the chat box or your contact details, and we'll send information out.
I just want to mention that Garrett also has a subgroup that I chair on the convention, an international subgroup, and we've been working very hard internationally as well.
Okay, we've got 3 more questions, so we'll hurry along. Mark Venning, VJ, and I'm sure this is not your name, but it may be, so my apologies. U3A Sutton All Doyle. So my apologies if I've messed that up. So if we can be tight with our questions, Mark, over to you.
Yeah, I just wondered if there was, Peggy, if there's any examples around the world of any movements around adopt a grandparent for those of us who are not grandparents.
Great question. Vijay, your question, sir?
Thank you very much, Dr. Jain. Now, but one observation, and Peggy has talked about it, is the question of grandmothers, especially, who are given the responsibility of grandchildren when the mothers of the children have abandoned the homes, and the grandmothers with very limited, sometimes not at all, financial resources have got to take care of these children. So there's a problem over there. This is one. Secondly, on the African continent, the AU, African Union, has already taken a resolution for the signature of a protocol for the rights of older persons in Africa. Now, if all the rulers of the African continent have decided that there be a protocol for the rights of older persons, this is a strength that can be used at the United Nations to advance the cause of the convention over there in the debates that are, this year we couldn't hold the open-ended working group on aging. So let's hope that this will come, and we have to get through, go through the African continent to achieve a step ahead in advancing the idea of a convention of the rights of older persons. Thank you very much.
Thank you, Vijay. U3A, Sutton?
Hello, Jane.
Yes, welcome.
Sorry, this is the University of the Third Age, as you know, is a worldwide movement.
Yes.
Is there any research or guidelines for older people who are both parents and grandparents? So with this COVID-19, a lot of adult children have moved back into their family household. And now some of them got accidentally stuck there because of the restrictions on the lockdown. They're now beginning to open up with the society opening up. They're fearful about going out and bringing back the virus in the same way that grandchildren were also fearful about giving the virus to grandparents. What would be the role of the grandparents or older persons in that? Is there any research or any guidelines? Thank you.
Okay, Peggy, there are three great questions. Over to you.
Okay, the first one about adopting a grandparent. I'm wondering if you're thinking of that from your point of view that, can you adopt, can someone in the community, can a neighbor, can other children adopt you as a grandfather? Is that what you're thinking? Or are you thinking of programs, for example, Help Age International has a program where you can pay and adopt a grandparent, just as in other places, with other organizations, you adopt a child. Which
no, I think that may have been another question.
No, just hold there for a moment. You're the third question, so just hold there. Mark, what were you?
Yeah, I was thinking more of the Big Brothers, Big Sisters model, kind of.
Right.
Okay, Peggy?
Right. That's an interesting idea. Informally, I know several friends, people who are surrogate grandparents to neighbors' kids or often to immigrant children who may not have a grandparent. And it's a very rewarding and successful relationship. When Mary Jane and I were working on the book on intentional grandparenting, we had a big discussion about, are steps the same thing? Our nephew, our aunts the same thing? Our surrogate grandparents the same thing? And we came to the conclusion that yes, it is the same thing. And we're not going to make any difference between step grandchildren and non-step grandchildren. And I think that it's just a wonderful idea if there can be a formal, informal adoption in the community. Go do it.
Okay. Thanks, Peggy. Next question.
Okay, the next question. grandmothers not having the resources. I wasn't too clear there. We know that they're not having the resources. What were you looking for there in terms of how can we better help grandmothers who are raising grandchildren?
Yeah,
That's right. Looking for the solidarity of society, civil society, NGOs, and ministry and government have to be roped in.
Right, and it has to be a combination. And that's, I think, one of the really good things about the Grandmothers Campaign. Works very closely with, as Sarah described, community organizations on the ground and grandmothers on the ground. At the same time that the Grandmothers Advocacy Network is working at the political level, both nationally and internationally. And you're absolutely right, we need that combination at all levels. Your second point was about the African Union establishing protocols for a convention. Absolutely true. In fact, they were one of the first groups, along with Latin America, to come up with the protocols. I would assume and hope that all of that work will be integrated into a convention on the rights of older people that can be used globally. One other thing to say, though, is that what we often hear from the grandmothers in Africa is that there might be legislation, there might be regulations, but they're not implemented. So, for example, on issues like land grabbing, it's against the law, and yet it happens. Because the police are not taking notice of it. It's a family issue, a number of reasons. So part of it is strengthening the implementation of these regulations and rights.
Okay. And the final question from University of Third Age, Peggy.
Yeah, lovely to hear from you. You were looking for guidelines and what's grandparents' role in terms of as we start to integrate and get outside again? Wow, tough question, because I think it will be different in almost every situation. When grandparents are living in the home with their adult children and children, I think their responsibility will be quite different than a grandparent who's a grandmother or grandparent who's living outside of the home. What are your feelings about that?
I don't think much thought has been given to the whole psychological and the fear of this virus, which is highly transmissible. And I think we need to do that a lot more when society is opening up.
Agree totally. Yeah. And I've talked to a lot of grandparents who've said to me, that they almost bristle because their adult children are so protective. They're overprotective, and again, governments come out with regulations that, the UK has just been very clear. You do not see your grandparent. You just don't. And that's just lumping all grandparents, all older people into one big pot and ignoring the diversity and ignoring the health status and ignoring the important contributions that the grandparents make and that the family needs.
I think it's a very difficult balance, though, isn't it, Peggy?
Yes, it is.
Because it's a fine line that we're walking. This virus is very unpredictable, we know. So and you see the stories of a 95-year-old or 103 that survived COVID. But we also don't understand, the functional implications of surviving COVID. And so I think it's, governments unfortunately are shooting from the hip when it comes to policy. So it's how do we manage risk? So we've got last two questions from Jane Simmons. So welcome, Jane, and then Fatma Maged. So Jane.
Hi, I'm based in South Africa, and we have a situation which is reflected in a lot of the African countries you talk about, where we have a very active grandparent community in their role of raising third generation children. And I'm looking, I look a lot at health promotion, and we're looking at the power that grandmothers hold in terms of controlling access to healthy behaviors or behavioral choices, whether they are the gatekeepers to that behavior or the enablers of that behavior. And I think, you know, we don't recognize the strength necessary in grandmothers in the health literacy of households. Because, and the, you know, grandmothers are not targeted as an audience on exclusive breastfeeding because they're not the breastfeeders. But if they are told about the value of exclusive breastfeeding, they're more supportive of their daughters' exclusive breastfeeding. And I think, you know, there's a role there that we need to look at grandmothers in particular. But how do we work with the strength and respect and the power that they hold in these communities in spite of being marginalized and often vulnerable?
Okay, and Fatma, would you like to ask your question?
Yes, the question is about being discriminated against. I am 72 years old. I can walk about 30 kilometers a day if I have to, but I feel like I was told that my age does not allow me to go out and be involved in the society and volunteer the way I did, as well as I have no problem because if I catch it, I may or may not die of it like anybody else. So my question is this ageism? I have a granddaughter I share with another grandmother who's not in her 60s yet, but my granddaughter can visit there and have fun with her other grandmother, but can't come and see me because I'm 72. So it is ageism, Peggy.
Great comments and questions. The first one in terms of the role of grandmothers in imparting health promotion messages and influencing the behavior of young people. Yes, particularly when they're the head of the household. And I think traditionally in most cultures, certainly in most African countries, that you know, grandparents are looked up to and grandmothers are listened to. So you know, you've made a really good point there. What we have found with the Grandmothers Campaign through the Stephen Lewis Foundation is that when grandmothers organize, you know, in groups, in support groups, they then are very interested in learning about health promotion, learning about, yeah, you're nodding your head, yeah. And then they deliver that message really well. So in fact, it's grandmothers, some of whom cannot read or write. But once they learn and they agree, you know, that such and such is a good policy or a good practice in terms of HIV prevention, in terms of prevention of pregnancy, etc., then they're the best teachers we've got. So in terms of, you know, what we have found is that get these grandmothers in support groups, work with the community organizations they work with, and through that, you know, you can get the health promotion messages out. And then Fatma, darn you, you always ask the hardest questions. You know, the answer to is it ageism, I think to some extent is personal. You know, I can feel your pain and your feeling. I've heard this from lots of other older women and grandparents that, you know, for example, another person who's a retired practical nurse and has worked all over the world. And when she tried to volunteer to help with COVID-19 in our city, they said absolutely no, nobody over 70 is wanted. And what bothers me is that they put that age on it. You know, like you're saying, the grandmother who's 60 can see the kids, but because you're over 70, you can't. And I really think we need a different way of defining these regulations or rules or guidelines. And it's not just based on chronological age. Sure, the older you get, the more vulnerable you are in terms of your immune system. But a 40-year-old man who has heart disease and diabetes is more at risk than a healthy 70-year-old woman. You don't agree, Jane?
Oh, I think this is a science that is beyond my scope. But if you only looked at vaccine preventable diseases, the number of deaths of older people, and that's 50 and over, as well as the functional implications that renders them requiring services for many years to come. So, the cutoff age is harsh, it's not well understood, and that's what we're living with. So I understand the pain that we are all experiencing in this, but also older people can be carriers of COVID. So, I could be COVID positive, look quite all right and volunteer and be contagious. So it's actually, we've got to come back to the intergenerational perspective of what we're dealing with. But Peggy, please, we're looking forward to hearing the letter that you wrote, and then I will wrap up with a few comments.
Okay, thank you, Jane. Okay, here's the terrific news, because when you're the guest speaker, you get to brag about your grandchildren, right? But on Monday of this week, my 6th great-grandchild was born. His name is Owen. And I have talked to many grandparents, and one of the underlying themes and concerns is the birth of children during this pandemic, and the fact that grandparents cannot hold, be near, hug this wonderful new baby. So before Owen was born and I was in this situation, I decided to write him a letter. And it is on your resources, so you can read it later, look at it later if you want. Dear Owen, I am so sorry that you had to be born in this frightening and dangerous time, and that my generation did not do more to provide you and your generation with a safe, clean, sustainable, peaceful environment that you deserve. I am sorry that the first sight of your parents will be compromised because they need to wear masks. And I am not able to physically hug you and hold you, at least for another few months. Please be sure that we love and adore you despite these constraints. Your parents have named you well. Owen comes from the Welsh and Irish Celtic tradition and means young warrior and well-born. Being a young warrior does not mean that you will grow up to be a fighter or join the military, but that you will grow with a strong character, demonstrating strength, courage, resilience, and exceptional ability to conquer difficult situations, like being born in the midst of a pandemic. My grandparents survived the Spanish flu, which killed some 50 million people worldwide. At age 72, I have witnessed humanity, global cooperation, and public health science defeat a number of infectious diseases, including polio, smallpox, diphtheria, SARS, and MERS. Thanks to the anti-vaxxers, war, and the lack of clean water and sanitation in some areas of the world, we are still working on measles, mumps, tetanus, river blindness, guinea worm, cholera, and other infectious diseases. COVID-19 is bad, very bad, but we will get through it. Hopefully, we will come out the other side with a changed world order, that your journey on Earth will be filled with green forms of power, transportation, and construction, with economics and social security systems that guarantee education and a basic income for all, and values and pays essential workers what they deserve, with politics that foster equity and non-discrimination and puts the health of people and our environment first. But two things will never change: the special relationship we have as grandma and grandchild, and the unconditional love I feel for you. Dare I say it, love trumps all. Welcome to our world, my darling Owen.
Oh, I clap you for that, Peggy. What a wonderful and inspiring closing message. I often ask our speakers to give us, a takeaway message, and there is nothing more powerful than the message that you have given us today that Owen will share one day. So thank you. In closing, gratitude for you being with us today, Peggy, and the inspiration and also the learnings. Acknowledge Margaret Gillis for her leadership in Canada. We need it more than ever, Margaret. And thank you, Sarah. You're also Canadian. Thank you for being with us today, and the Stephen Lewis Foundation, the work that you do. There has been a tremendous amount of resources in the chat box, so please gather those. I always and need to, because they're a fabulous group of individuals that I have the pleasure of working with. Thank you, IFA staff. And for some reason, I need to name you all. Andra, Anna, Ifan, Natalia, Greg, Jun, Chesley, Vanessa, and Megan. Thank you. And my closing remarks really come from a Nobel Peace Prize laureate in the midst of what I believe is unprecedented times, Lema Gbagbo. And she writes, amidst the relentless civil war, I never lost hope for a peaceful future and believed in the power of women's solidarity to broker lasting peace and security. With leadership, thousands of Liberian women formed a non-violent movement that brought together Christian and Muslim women, and in 2003 played a pivotal role in ending Liberia's civil war. And her closing remarks were, we succeeded when no one thought we would. We were the conscience of the one who had lost their consciences in their quest for power and political positions. Grandmothers, grandparents, grandfathers, and all of you today are civil society working towards the rights of older people and learning from one another as we grow. So thank you for being with us today, and we look forward to you being part of our town hall next week, when we have the great pleasure of listening to Kimberly Whaley, and she's going to be looking at elder abuse through the lens of, the legal fraternity. So join with us, and thank you all for being with us. Be well.